Afternoon. Thank you all for joining. Um, Thank you so much, Ruby. My name is Audrey Gray. I'm the Senior Manager of Clinical Professional Development in the pre-post areas in Peri-Op. So, show of hands, who likes college basketball? All right. We're in the middle of the Sweet 16, but we are going to make sure we just talk about the Final Four. I personally wish St. John's went to the end, being a Queens girl, but unfortunately they did not. But it's okay. I do think that basketball is a great way to get a better understanding how we, the Periop team, works together and showcase our staff working together on a unit level, but also incorporating interdisciplinary brackets to have our surgical patients be the champion of. All right, so this is our perioperative team that we'll be showcasing today. So we're going to be talking about pre-surgical testing, same day, post-anesthesia care, and pre-post education. The OR is definitely part of our perioperative team, but this complex department would require its own presentation. Communication and collaboration is imperative between all of these departments to achieve excellence. Today, you will hear from key players of our team to help the audience learn the well thought out play of a patient's journey from prep to recovery. I have the pleasure to introduce Robert Santana. Rob is one of our senior nurse practitioners in PST. Rob is a nurse practitioner specializing in family. He's been working at North Shore for 11 years. He started his nursing career in 1988 and became a nurse practitioner in 2020. He accepted the role as senior nurse practitioner in North Shore's PST in 2023. Please welcome Rob to the mic to begin our patient's journey. 98.
I'm not that old. I am. Good afternoon, everybody. Welcome. Thank you for letting us do this presentation for you. Uh, so what is pre-surgical testing? This is our team. Um, Pre-surgical testing refers to the medical evaluations and procedures performed before scheduled surgery to assess a patient's overall health. In doing so, our team um, identifies any potential risks or complications that might arise during or after surgery or procedures. At North Shore University Hospital, our PST team is responsible for not only patients having surgeries or procedures at the main hospital, but also for patients' pre-surgical testing um, for going to short ambulatory surgery also. You know, the one thing I want to say about team, at least with us in PST, and I think it's pretty much throughout the whole peri-op. I've been through same day as A&M there. I was a PACU nurse in ambulatory surgery, and now I'm a nurse practitioner here in PST. The one thing that reverberates throughout the whole peri-op system is that we're a family. So team is synonymous with family with us. So at least in pre-surgical testing, you know, I'm proud of our team, you know, outside and inside. You know, the team does a lot of volunteer work. They go to Ronald McDonald House. That was something they did this last year. They do community outreach programs with students. And our PCAs do clinical ladder, and they do beautiful things in terms of education. And they did recently this heart health education for the peri-op team. So it's really proud to be part of this team. So here's our starting lineup. Our team is comprised of 36 advanced care providers, and that, you know, encompasses nurse practitioners and PAs. We have 6 patient care associates, 5 secretaries, and we work closely with registration and the anesthesiologists to ensure that patients are cared for and treated as stars like they are. So this graph depicts a total volume of 2000 in 2024 and 2025 of all the patient volume we see. Our monthly volume has a range of over 1,700 patients to 2,000 a month. As you can see from this chart, our volume patient visits has increased in 2025. So what's our game strategy or the assessments that we do in PST? In other words, what do we do for our patients? We do comprehensive history and physical. We review medications, vitamins, or any supplements they ingest. We ask questions about their health, about their medical and surgical history, or anything that would, preclude them from having anesthesia. We identify medical problems that need to be treated before surgery. For example, anything cardiac. If that's the case, then we ask them to get a cardiac evaluation or medical evaluation, and we review labs and tests that may be required prior to surgery. To determine, sorry, um, we also determine if the patient's fit for anesthesia. We identify patients at high risk for high risk complications, and we guide the patients through a perioperative journey and post-operative management. So what's our pre-game motivation or our education? At this point, I just want to thank the perioperative education team and our leaders for allowing us to do this. They provide a lot of information from us from, one-on-one services in terms of, going through ACLS again and Denise with her monthly education with many providers that she provides for us and ensuring that we're always up to date with education. And in doing so, what education do we provide for our patients? We stick basically with the basics. We provide education as simple as the patient can understand and the family can understand. We educate our patients on enhanced recovery protocols. For those of you who don't know anything about that, the protocols are there to optimize the patients for surgery. ERP protocols are evidence-based and have shown to improve patient outcomes and decrease length of stay in the hospital. We provide information about NPO status before surgery and educate them about what this means to a patient. If many of you don't know what that means, which you should all know what that means, is nothing by mouth. We also provide information about stopping medications, such as anticoagulants like Xarelto, Eliquis, GLP-1 agonists, Ozempic, SGLT2 inhibitors for SIGA, and just to name a few. We also provide information about bringing what to bring to the hospital and what to leave at home. And what are our key plays or our tests and procedures? The decision to order tests and diagnostic depends on the patient's clinical presentation, medical history, and physical exam, and the type of surgery they're having. When required, we send the patient for a preoperative evaluation, for example, cardiac, pulmonary, neurology, rheumatology, hematology, and those are just a few that we mentioned. We closely work with several of the service line medical offices just to ensure that all the patient's history is up to date. We also work with anesthesia, and they're always available for consults and to review the patient's charts to ensure patient safety. So let's take a quick poll.
So we're on our first.
I am that. Thank you all for coming. So same day, SDA, pre-op. We're called a lot of things, and people say, where is that? What is that? Same day admissions. We are the place that people come to from home or from in-house prior to surgery. We're located on 2 Tower, and we have 19 private rooms. Fun fact, we were the original CTU. We're a team of 51, 33 RNs, 12 PCAs, 4 secretaries, a nurse manager, and an assistant nurse manager. We're open 7 days a week now. We used to not be. We're glad to be open 7 days a week. From 5 o'clock in the morning till 9 o'clock at night, Monday through Friday, and 5:30 to 5:30 Saturday and Sunday. Let's see. What are we proud of? Well, the day of surgery is a time of very high anxiety for the patient and their family. So we are really proud of our patient experience. It's imperative for us to convey confidence, caring, and skill to gain the patient's trust in our team and institution and foster positive outcomes. The SDA team strives also, like Rob said with his team, to help the community. We've been involved in NAACP Health Fair, blood pressure checks and education, volunteering at the Mary Brennan Inn and Jones Beach Walk. All right. So this graph depicts our volume for 2024 and 2025 year to date. Our monthly volume has a range of over 900 to 1,200 patients. And as you can see from the chart, we are also increasing in volume. Pre-game pep talk. So we start our interaction with the patient the night before surgery. We call the patients at home and we we give them like last minute information, what time to arrive to the hospital, usually 2 hours prior to their scheduled time, sometimes a little bit more. Directions on how to get to the hospital, where to park, where to meet security if they need help with a wheelchair, location of the surgical waiting room. We tell them also what to bring, what not to bring. We then review what they already learned at PST as far as NPO status, what medications to continue, what medications to stop. I know you're all experts on Farxiga now. And we talk to them about any last minute questions that they have. Okay, the check-in process for patients arriving the day of surgery. As I said, we have two types of patients, patients that come in from home and go through same-day admissions before they go to the operating room, and there are patients also that come in from the floor, in-house patients. So the patients that are coming in from home, they'll go to Monty, the surgical waiting room. That's also registration. They meet our registration team. In fact, hey, where's Jomo? Jomo, there he is. Jomo is our rep for the day. Okay, so now this slide really refers to a lot of people here. This is where everybody else in the hospital becomes part of our team in getting our in-house patients ready to come down to the operating room. We will, the same day staff will call the floor, get report from the nurse. We're looking in Sunrise, we're looking at their H&P, reviewing their lab results, trying to get as much information as we can about the patient and before they come down to us. And it's really great. A lot of you help us out so much by having the patients ready when they come down. They're wearing just a gown, no dentures, jewelry. I'm sure you've all heard us say this on the phone. Dentures, jewelry, cell phones, possessions. Leave it all behind because there is no place for them to leave it in the operating room. So we appreciate that. After we get report from you, we'll have teletracking come and get the patient. Transport will bring them down to us. We will do our interview with them, and then they'll be ready to go over to the operating room. Okay, so pregame huddle. This is a really important part of what we do. We gather the entire team. We'll see the attending surgeon. We'll meet the residents, the anesthesiologist and their support staff. We meet people like company representatives. Who else do we meet? This is where everybody meets. We escalate any concerns that we have. The patient, the family, they have the opportunity to talk to everybody, make sure we're all on the same page, make sure the patient, the family are informed, and we also check all the lab results. We complete any last minute lab results, a UCG, type and screen, ABO, potassium, make sure everything is up to date, escalate any concerns that we have, any concerns that the family has. We'll use the language interpreter to also make sure that anybody with that's not English speaking does understand what's going on. Our consents are also in their language. All right, What?
Next slide, you're good.
Oh, okay.
You're up. No, you're perfect. You're on.
All right. Yeah, now, so now, once we've met everybody, we obtain consent, informed consents, and we're ready to go to the operating room.
Perfect. All right, I love it. All right, so now we're going back to another, oh, no, stay, wait, stay. Thank you. Hi, everybody. So I'm here to talk to you about our real-time actionable data Care HQ platform that we have. This exists not only for perioperative services, but for the system as a whole. So this was developed for our perioperative services team, specifically with our leadership group and Northwell's integrated operations team, basically to serve as a way where our teams through same day, PACU, the operating room, and our surgical waiting room could all communicate seamlessly to really optimize our patient's journey from arrival in the building to when they hit the PACU after they're done in the operating room. This system is managed through a few of the systems that we use in-house. So it's through Sunrise, it's through Envision, and it's through another platform called SIS, which is where the peri-op team schedules all of the patient's procedures. Go to the next. Okay, so after our same day team has met the patient, all of the consents have been signed, everybody has used our platform to communicate and they know that the patient is ready to go. It's time for our team to take their halftime and our patient's going to travel into the operating room. Perfect. So now we have a fun little game because I always like to do interactive things. We are going to, I'm going to change the screen. I'm going to ask for our ref to come up, and we need one volunteer, which I'm selecting our Senior Director, Emily Kelty. And we're going to have a little competition. How many baskets can they score? I'm going to just make sure people online can go wide. Does anybody see? No, I know I will.
Good afternoon. Thank you all for coming. I would like to discuss the role of PACU in the patient's surgical experience. What is PACU for starters? Post-anesthesia care unit, also known as a recovery room. The terms are interchangeable. This is where patients come from the OR to the specialized area to be monitored and cared for immediately after surgery as they recover from anesthesia. This period of time is referred to as phase 1 recovery. When patients meet criteria for anesthesia clearance, they can then progress to what is known as
Which one?
phase 2.
What happened? Okay.
Mute online, please.
Mm-hmm.
During phase 1 care, our
Cool.
nurses
I'm
will
doing grand
closely
rounds.
monitor and
I'm sorry, someone online.
we were the first PACU in New York State to achieve this honor. And we were the third in the country. Of note, we also went to NTI, which was in Denver in 2024, to present our poster that won us our Beacon honor. Our team is also very involved in various community service initiatives, ranging from health fairs, beach cleanups, health education for youth in our community, and wellness initiatives for our staff. So in 2024, North Shore achieved a significant milestone. We recovered over close to 12,000 patients across all perioperative recovery spaces. In April 2024, if you'll notice on this chart, this breaks it down by month, but in April 2024, SDA was also now doing phase 1 recovery, which was helpful in offloading some of the OR cases so that we could focus on the more complex cases in our PACU. Looking ahead, we anticipate our volume of surgeries to increase so that we can enhance our surgical capacity. Our PACU happens to be a 29, can you hear me? Is this better? Okay. Our PACU is a 29-bay complex recovery room with 1 isolation room. But we will be moving to a new PACU, which is presently under construction, and we will have 42 bays with 2 isolation rooms. Our PACU not only recovers patients from the operating rooms, but we also assist with recovery with interventional radiology, EP, endoscopy, and if patients require sedation for MRIs. We are located on 211, but like I said, we will be relocating next year. Our staff consists of 85 team members. We have 60 nurses, 13 PCAs, 5 unit secretaries, 3 acute care nurse practitioners, our nurse manager, and 3 assistant nurse managers. We are open 24 hours a day, 7 days a week. Our staffing model is designed to reflect the recovery of 60+ surgical cases per day on Mondays through Fridays. On weeknights and on weekends, our staffing levels are adjusted to accommodate a lower volume of elective cases. On the weekends and holidays, we also utilize an on-call system. Our goal is to care for the patient at their most vulnerable time, to critically think and assess and appropriately manage the patient to safely and efficiently recover them from anesthesia. PACU nurses are trained to follow ASPAN guidelines. These evidence-based recommendations help us guide appropriately the staffing ratio for our patients, reflecting safety and efficiency after patients have received anesthesia. According to ASPAN guidelines, the recommended nurse-to-patient ratio is 1 nurse for 2 patients in phase 1. However, if you have a critical patient or a renal transplant, that may require 1-to-1 nursing. We also use a tool called the Aldrete score. It's used to assess the patient's readiness for PACU discharge. The Aldrete score measures activity, respiration, circulation, consciousness, and oxygen saturation. The goal is always to get the patient back to their baseline. A score of 8 or above indicates that the patient is fit for transition to phase 2 recovery. So our team huddle, our patient playbook. When patients are moving from one area of the hospital to another, it's always, the goal is to always ensure a safe and secure transition from one phase to the next. Typically, when a patient is ready to come out of the operating room, the OR staff will call the PACU charge and give a brief handoff about what the patient had done. They will communicate any pertinent information that is needed, or if any special needs are needed for the patient in PACU. Arterial line setups, central lines, medicated drips, vents, CPAP, any sort of support that would be needed. The charge nurse, then using those ASPAN guidelines we just went over, will designate a recovery bay, and then at that point is when the patient starts to make their way from the operating room to the PACU. As the receiving nurse, if I were the receiving nurse, I would get report from both a surgical specialist and an anesthesiologist. They will provide a bedside report that will let us know what the plan of care for the patient is, as well as any concerns they may have post-op. When anesthesia gives report, they let us know about any medications given and any concerns they may have post-op. Then, as the PACU nurse, I would do a thorough head-to-toe assessment. All body systems are addressed with more focused assessments based on the patient's recovery. For example, if a patient had a carotid endarterectomy, not only would we be doing our regular assessments, but we would be doing more focused neuro assessments. We would be monitoring for airway concerns, as the incision is right by the airway, and pain, nausea, and obviously their vital signs would be monitored per protocol as well. So post-recovery recap. Where do the patients go next? Patients can be discharged from recovery and they can go either to home, they can go to the floor, or they may transfer to the ICU if that is needed. In certain cases, patients do end up staying in recovery overnight. Some patients that are 23-hour stays will spend the night and be discharged the following morning, or some patients may need to stay overnight if the hospital is at capacity and cannot accommodate that patient. When the beds are available, patients will then leave PACU and go to wherever they're designated to go. Now, to conclude this section, sorry, we have one last poll.
So education's full court press. As I mentioned earlier, we cover pre-post areas in peri-op. Also, pre-surgical testing, same day, ambient, shorts, the PACU, and endo and bronchoscopy as well. You know me already, so I just want to take a moment to introduce my team. Ann Langen is here, red shirt, Ohio State. She brings 33 years of nursing experience, 25 of them being a nurse educator. She has her doctorate in nursing practice and extensive experience in both clinical and academic settings. Ann possesses a wealth of knowledge. Her passion for evidence-based research is a valuable asset, and we are thrilled that she came to be a part of our team in 2023. Our other partner up there, Amy Janicek, had a family emergency, so she couldn't be here today. But I do want to acknowledge her contributions to our team. She brings over 20 years of nursing experience, including time spent in critical care, in post-anesthesia care, and leadership. She transitioned to the education department in 2023 after she got her master's, bringing valuable practical experience to her role as an educator. How is our team part of a patient's journey? We have always been full court press since I've been an educator to provide education and resources for our staff. And we want to make sure that our staff provide safe, high quality care to our patients. We joke and we call ourselves AAA, Amy, Ann, and Audrey, which is fun because like the AAA automobile company, their motto, which I didn't know, is anytime, anywhere, and always. And that's what we follow. We provide one-page educations to our weekly educations. We love interactive games. We love return skills. We make sure that we want to have people understand. We also created a Teams channel that has all of our educational resources online for all of our staff, which is available 24/7. So if they ever need anything and we're not available, we make sure they can have it. And here is Ann.
Training camp. What's training camp? What is it? What's training camp? Practice? What is it? Yeah. So it's how you get started, how you get great at what you do, right? So every one of us have to go through that process. So for peri-op, we have two distinct pathways in which you can become a part of our team. Historically, you had to have that's new, ED ICU experience to join the team. But something changed. Something changed at 300 Community Drive. What changed? PSP. So there are two distinct pathways, like I said. So the ED ICU nurse came into our area. They had 2 years experience, and they worked to learn all those specialties that we just talked about. 12, 16 weeks, they were up and running as a recovery room nurse. However, PSP changed everything for everybody, right? So with the expansion of PSP in that pavilion, it allowed SDA to expand their clinical practice, and it also expanded the PACU's reach. So the idea is, how are we going to get 15 nurses immediately at one time? It's very hard to get 15 critical care nurses to start at one time. So we had to have a solution, or we had to come up with a solution. The solution was create a pre-post RN fellowship that allowed med-surg tele nurses that were interested in the peri-op experience to join us. So that also is a cross-training program, which was new for Northwell or new for North Shore, that allowed not only pre-op, but post-op cross-training experience. Before, you either went into the pre-op unit or you went into the post-op unit. Now we have a cross-training. So upgrading our arena, again, PSP, right? 300 Community Drive has a beautiful Petrocelli Surgical Pavilion. That changed everything for our service line. Upgrading the arena is going to benefit our patients. So how do we impact that with this new facility? So the Peri-Anesthesia Nurse Fellowship was the first for Northwell at North Shore. It is the first Peri-Anesthesia Nurse Fellowship. It is a 6-month blended learning module, which includes e-learning modules, simulation, didactic lectures, and clinical immersion with a preceptor. We had 15 fellows in our first fellowship, our inaugural fellowship. They graduated January 2024, which allowed then our incumbent SDA staff to also get cross-trained to that phase 1 recovery experience. This cross-training was individualized for our incumbent SDA staff with respect to their experience and their individual contributions to the team. The staff were also enrolled, the incumbent staff was also enrolled in e-learning modules and a clinical immersion experience. It varied based on their learning needs, so we were adapting to our needs in our new clinical practice. Cross-training allowed us to grow in the PACU as well. The PACU night RNs have been able to cross-train to the SDA preoperative area, something that was not part of their practice before. That is an ongoing process, but again, becoming that one team. This also allowed, because of SDA recovering, it allowed for the PACU nurses to now recover the structural heart program here at North Shore fully. And it gives an opportunity for other areas in the hospital, as Nick Lahair mentioned, radiology, endoscopy, and so on. Go ahead. So we'd like to expand the court. We want to keep playing this game and keep future growth in surgical recovery here at North Shore. So our perioperative areas continue to grow, and then that means that a need for recovery spaces continue to grow. So our education team has to seek methods that are going to support those two needs. We thrive on interprofessional collaboration with our service lines. Our team sets up one-to-one meetings with the teams to allow that one in-person education recorded, put on the team's channel. We build relationship with our 14 service lines and all their services within the hospital, such as PT and RT and transport. How we like to improve, we like to collect information, do pre-post evaluations on all of our work. One of the improvements we want to share is no one likes to have an emergency on their unit. But do you want to be prepared when an emergency happens on your unit? Of course. So how do we get better at what we do? We would like our teams to feel prepared, so we developed a mock code skills fair in 2024. All of our service line departments went through this mock code skills fair in stations, and then we took our show on the road and we did on-unit mock codes simulations in the units and continue to do this process to keep that level of practice and level of competency where it needs to be. We surveyed our staff before and after the skills fair and the simulation, and our preliminary results show that there's a significant decrease in anxiety during these codes and an increase in their knowledge and their training.
Great. We are now celebrating the patient's journey. So we have made it from prep to recovery. We highlighted our 4 units in this presentation. But one thing I'd like to note is that it really includes all of you that are in here as well. Because if you guys weren't here on the floors and in your recovery spaces and in the operating room, we couldn't do what we do. And the collaboration that we have with PT and all the other disciplines has really made it something that we can be proud of as a North Shore team. Because our patients are happy, our patients are successful, and their journey is because of all of us in this room. So I want to thank you for this time, because now the game is over. The patient has won. And thank you very much.